Good evening, everyone, and I hope you're all doing well. For those of you who don't know me, my name's Troy, and I'm the Director of Operations for nurses specialized in wound ostomy and continence. And I'll change my name here just so you can recognize me as well on Zoom. You can see some people are already put in the chat. Hello and happy Swan Week. If you feel like you would like to, please open up that Zoom webinar chat and let us know where you're tuning in from today. I'm tuning in from Ottawa, Ontario, the unceded territory of the Algonquin Anishinaabe Nation. And it is awesome to be seeing everybody from across Canada and beyond today. It's a great honor for us to be having this week today as we kick off Swan Week 2024. And today we're really looking to celebrate and recognize an amazing group of people who are extremely vital to our association. That is, of course, our Skin Wellness Associate Nurses, or our SWANs. This week, we're recognizing the incredible impact of our SWANs they have on patient care and beyond. And so I'm happy to introduce our theme this year, which is Beyond the Bedside, supporting the transformation of care delivery. And so this theme, what we tried to do with this theme is perfectly capture the profound ways in which SWANs contribute not only to the patients they serve, but to our entire healthcare system across Canada, and try to encapsulate that from a province to province and territory to territory kind of view. And so SWANs aren't just working at the bedside. We're advocates for patients, helping them navigate what they can often feel like a confusing and difficult healthcare system. And especially when they're coming from a point of where they really are looking for a lot of support. We're so happy that our SWANs are equipped to help support the patients that we serve here. As I said here, they ensure that patients' voices are heard, making sure that care plans can truly reflect the needs and preferences of the individuals who are dealing with wound, ostomy, and continence issues. And what's truly remarkable at SWANs is how they bring our specialized or their specialized education to bear, not only delivering exceptional care, but also upholding and spreading best practices and more things that improve patient care and patient outcomes at the end of the day. And so I just wanted to touch briefly on another key point of our theme, which is about the SWAN contribution to healthcare transformation. So as we said, we do more than just care for our patients. We're actively involved in transforming healthcare, and we're a big part of supporting existing systems that are trying to do that too. So their specialized training allows them to identify gaps in the healthcare system, help lead and implement quality improvement initiatives. And again, a lot of this is going to be a collaboration with our NSWOCs, our nurses specialized in wound, ostomy, and continence. The SWANs are part of this larger team, are working hand in hand with NSWOCs to ensure the knowledge that they've gained isn't just staying with them alone. It's together disseminating critical insights on wound, ostomy, and continence care and reaching even more healthcare providers, patients, and other people part of the healthcare ecosystem. And really what I think is incredibly exciting and is really amazing to see across Canada is how committed SWANs are to professional development, to continuous learning, and offering peer-to-peer mentorship and support with each other. And that, of course, works for SWANs who might be working in relation to an NSWOC or SWANs amongst a team together. It might also mean networking and speaking with colleagues from across Canada or across province. For example, when we have our summits in different provinces, or even when we're at our national conference, it's always amazing to see that collaborative energy and that spirit of working together and sharing some good insights, sharing some best practices, sharing again what this SWAN program, which is only just just over 4 years old now, showing all the learnings you can take from that and how you've implemented that into your practice from across the continuum of care. So in summary for that point too, it's amazing to see that the sharing of knowledge strengthens our entire profession. And that goes for the SWANs and your great representatives of all those who share a tri-specialty, including our NSWOC colleagues as well. So when we think about SWANs, we don't limit their role just to providing care. We're doing so much more. We summarize it as an educator, as mentors, as advocates, as peer-to-peer supporters, and overall change makers. So we hope that theme kind of emphasizes that as well. And so by supporting SWANs, whether from our association top down or by employers, or other colleagues across the ecosystem supporting SWANs, we're not just improving the quality of care for individuals living with wound, ostomy, and continence needs, but we're also actively transforming the way that care is delivered. And you probably will have seen some of these points made in our NSWOC Power of Three, and we're looking to do the same thing with our SWANs. We want people to know that investing in SWANs, investing in the expertise of SWANs and their role is going to make a huge difference for Canadians all across the country here. This transformation is leading to more efficient, patient-centered, and sustainable healthcare system for all Canadians. And so what we believe is that the work that SWANs do is essential, and it's important that we take this moment and take this week to recognize that. As you all know, we do an NSWOC week, of course, in April as well, and we're really happy. This is our second SWAN week. Last year was our inaugural week, and we're really happy that you're going to be with us to participate here. So as we do this, I'm just going to pull up our programming calendar so everyone's aware of what's going on this week, because we want to make sure you have an opportunity to join us. So I'll share my screen here. And if you can take a look at this, what we're looking at here is a full week of some great activities that you can all participate in, whether you're a SWAN, you're maybe might be a practical nurse, an LPN, RPN interested in becoming a SWAN. You might have just heard about SWANs this week even, and you want to get a chance to learn more. Or maybe you're an NSWOC who also wants to participate in some of these as well. Tomorrow is going to be the first sort of start. After tonight, of course, we have our SWAN Week celebration. Tomorrow on Tuesday at 7:30 p.m. Eastern, that's 4:30 p.m. Pacific, we're going to be doing our SWAN community practice meeting and info night. So if you're a prospective SWAN or you're interested in potentially becoming a SWAN through our SWAN program, this would be a great place to start. You'll have an opportunity to speak with some other SWAN students and SWANs, as well as their academic advisors and more people who are heavily involved in that program or as SWANs across Canada, to get a sense of what's going on there, what the benefits are, ask some questions as well, and really start becoming involved in this community. And then Wednesday, we've got a great day here. The first part of the day is going to be at 7 p.m. Eastern, 4 p.m. Pacific. That's our integrating silver dressings into the antimicrobial toolkit and tips for biofilm eradication. This is a webinar, an educational webinar that's actually hosted by Smith & Nephew. We're partnered with them to host that one. For those who are interested in attending that, you will get a certificate of attendance as well. And you'll have an opportunity to ask questions as well to the panelists. And then right after that, we're going to be going into a separate event, which is Journal Club. And so this is going to be on a very interesting topic. It's on 3D printing applications in ostomy device creation and complex intestinal fistula management. That's going to be at 8 p.m. Eastern or 5 p.m. Pacific. I'll give you a quick little brief overview of what Journal Club is. Journal Club is an opportunity for any of our members or associates from NSWOC or guests, you're welcome to invite someone too, of all different experience levels and interests to come and join and discuss an article at hand. We try to change that topic each month, so it cycles from wound to ostomy to continence. And this is actually going to be our first Journal Club back. It's a monthly Journal Club. It's our first one back since June. We usually take the 2 summer months off. So we're really excited to be having that Journal Club topic. And again, it's going to be pretty well laid out for you. You don't have to come in doing much more than just having reviewed the article. We have some great leaders on our membership core program, including Angela Koziak and Shelley Barnes, who are some NSWOCs who will help kind of direct the conversation a little bit, give you an opportunity to speak up. And we really do welcome everyone to come there. We're going to try to make sure that everyone has an opportunity to ask questions and learn a little bit from each other. But at the end of the day, it's a pretty relaxed environment and opportunity for you to just interact with others. And that takes us to Thursday. So on Thursday, September 19th, also at 7 p.m. Eastern, 4 p.m. Pacific, we're going to be having a different webinar. Now, this one is very specific to our SWANs here. That's going to be called SWANs in Action, which can be case studies and collaborative initiatives across Canada. And that's going to be separated into 2 separate parts. The first part will be talking about 2 different cases. The second part is going to be talking more about the SWAN role insofar as SWANs being a part of this wound, ostomy, and continence team in collaboration with NSWOCs. So we'll have 4 different presenters across 2 main topics, and we really do hope you have a chance to come there. There will be a Q&A period at the end too. So if you still have further questions at this point, or let's say you did get a chance to come to the community practice meeting or info night, we do welcome you to come to that as well. We'll try to do our best to answer those questions, but we really think by attending 1 or more of these events this week, you'll get a really good, well-rounded view of who SWANs are, the benefit they bring to our healthcare system across Canada, and some of the benefits of just joining NSWOC as an associate member and really taking advantage of this huge countrywide network of colleagues who are all working to the same goal of improving and access and patient outcomes for those living with wound, ostomy, and continence challenges. And I see in the chat here, Vita's mentioning Journal Club is a great way to look at recent journal article and see how the knowledge and products are incorporated across the country. And that's a great point too. Sometimes we are looking at very specific innovations in wound, ostomy, or continence products. So it's very exciting to see the kind of different topics. And Vita is one of our recurring attendees there. Vita is also going to be one of our presenters on Thursday as the SWAN academic, the leader of the SWAN academic advisors, and she'll be a great person to have a chance to talk to. So we do invite you to join us for all those. I see that our CEO, Kathy Harley's come on. So before I pass it over there, I'll just quickly let you know where you can access all of our SWAN Week resources, because this will be a great place to share with your colleagues or for you yourself to access to if you haven't already had a chance to do so. So on our NSWOC, NSWOC.ca website, there's actually a page called SWAN Week, and I'm just going to try to pull it up here on the other side on Zoom. Let me stop sharing here, and I'll pull this up in just 5 seconds. And on our website, what we're going to have there are a couple things. One of the main components is our SWAN Week. Sorry, let me just pull it up here. Let's try this again. Perfect. All right. Thanks for your patience there. So it's nswoc.ca/swan-week-2024. There's also a place you can access it right off our homepage. And aside from the points that I sort of covered today, you'll also be able to download our SWAN Week flyer. You can just go ahead and click on the image there. You can also access some of the great messaging points that we put into the little social media share images that you're welcome to post on social media, or encourage your facility or your employer to post as well in celebration of SWAN Week. You can also register for any of those upcoming events that I've just kind of gone over there with you. So again, aside from today's celebration, you'll have a few others to take a look at as well. So as I get to the end of sort of my component here, and I'll put this link in the chat too for anyone who needs to access it, I'm really, really thrilled to introduce our commander-in-chief and our leader, who is Kathy Harley. Kathy Harley has been our executive director turned CEO for over 20 years now. We celebrated Kathy's involvement at our national conference this past year, and we cannot thank her enough for all of her support. And I'm sure, Kathy, you're going to talk a little bit about how we can't thank our SWANs enough for everything they've been given across Canada. So I'll turn over the mic and the camera to you.
Okay, thank you so much, Troy, and thank you to all of you for taking the time to come together as we launch this kickoff to SWAN Week. And you can see by the marketing campaign that Troy has pulled together with his group, SWANs Beyond the Bedside, that you are bringing tremendous value into the healthcare system. So there's never been a better time to be a SWAN than it is now. There's been a considerable amount of work been done in the background, and this type of work is really designed to further develop the SWAN role and to raise awareness at both the government and the senior administrative level. And so discussions have been taking place where we've been advocating for the SWAN role from the Minister of Long-Term Care in Ontario to the senior administration for the community in New Brunswick. And there's many other places in between. And what we're doing is really talking to these groups of individuals about the role that the SWAN plays in really becoming a strategic element of the team that is delivering wound, ostomy, and continence, and working with NSWOCs as a team. And our message is starting to resonate, and we do have models and frameworks that are starting to be developed, which are including a SWAN, and you're going to hear about more over the next 6 months in particular. So I just wanted you to be aware of that. So I also want you to know that we stand behind you, and we look forward to seeing your role grow across the country. And we hope to see SWANs eventually in most provinces across the country, and we can see that our numbers are rising with every cohort. So the other thing I wanted to let you know is that as part of raising awareness around swans, we've also been working on a swan marketing campaign. And what this involves is a presentation that we'll be sending out to all of you. It's done up in a nice PowerPoint presentation with the SWAN branding colors and all the key messages. And this will be available to you later this fall in order for you to be able to give presentations within your own facility on who a SWAN is and the value that you bring to the healthcare system and the healthcare team. And so the messages you can see here in the campaign that Troy was leading have been infused into the marketing campaign. So that will be coming to help support you moving forward. And so I think that if we can develop these tools and we can continue to advocate in support of your role, that we will see the expansion of swans from coast to coast. And so I think this week, it's really a time to celebrate you and celebrate your role and encourage all of you to step up and advocate for yourselves. I do know that there are some swans that I've talked to recently who said, I've taken the SWAN program and I'm working within a long-term care facility, but I'm working as a generalist. I'm not recognized for my SWAN role. But then we've had other conversations where these swans have been in place, and then the senior administration is saying, well, as we develop our new model and our new framework, we do know that we need to change and recognize and institute a formal SWAN position. So I think that if we can continue to work as we are, we'll be able to get that to happen over the next 6 months to a year. And so I celebrate you. I'm thankful that you have decided to become a SWAN. Thank you to Vita and Shelley and all of the academic advisors who are supporting SWANs. And thank you for the role that you play in delivering better patient care because it is really essential for the Canadian healthcare system. So thank you very much. And I look forward to seeing you and all your activities that are coming out this week. And thanks again, Troy, and I wish you all of the very best.
And as we just continue to share some of the thanks, I know I put in the chat here, but I just want to reiterate how much we appreciate Matthew, Jennifer, Dana, and Celeste, who you can see on the flyer here. We really appreciate you taking the time to send us some of these great photos and being our images here that go along with some of our marketing material. We really appreciate it. And it's great to see real swans doing real work across the country here. It's awesome to see you there. So I'll echo what Kathy said. And we'll wish you all the best for the rest of the evening. If at any point you have any questions or you want some more support, please do email us at office@nswoc.ca, and we're always going to be happy to help you out. As I said, whether you're a student, you're an existing SWAN, or you're someone who's just a little bit more interested in developing your career further in the wound, ostomy, and continence specialty, we're going to be there for you every step of the way. So do reach out to us and we will be there to help. Have a great night, everybody.